The butt is the new breast. The aging buttock, Stafford. There's a lot of new things out there. BBL, I don't even know what that is. What can we do with the aging buttock?
First of all, let me tell you what BBL, it's Brazilian butt lift. So that is more for a younger buttocks that wants more volume. We put fat in, it works. So what can you do for an aging buttocks, not one that just needs a little bit of a lift but with excess skin? You can get rid of the skin, you can add more volume, you do a little of both, and it's not the greatest outcome, I don't believe. What do you think?
Well, I mean, I would agree with some of what you said. I'm not sure that Bill's right in that the buttock is the new breast is really the buttock, the new breast. The buttock's important, and we certainly love a nice, curvy, beautiful buttock. And I think that to your point, obviously you tailor the solution for the patient. Someone who's got an aging buttock. What is an aging buttock? Sagging, loss of
It's an old buttock. That's what aging is.
Sort of wrinkling, kind of dangling down.
Right.
But an aging buttock could be just a flat buttock. Doesn't necessarily have to even sag all that much. There are some women that just have lost volume and they've lost shape. And so in those cases, it might be a great idea to suction away some fat if they have extra fat elsewhere and volumize the buttock and enhance the shape. It's not just about volume, it's also about reshaping, don't you think? And so in that case, you can reshape the buttock and add some volume by taking fat from an unwanted area. That's what a Brazilian butt lift is, right? And injecting it very safely in the subcutaneous tissues. We should spend some time talking about safety here because there have been a lot of deaths with injecting it deep. So you got to see someone who knows what they're doing. Don't you agree, Stafford? So
completely. You don't want someone who's trying this for the first time.
No, and you want someone who knows what they're doing, understands how to craft it and make it look beautiful. But you're right, because it may not just be the only solution for someone who's got flaccid buttocks.
So in that skin excision is what we call a belt lipectomy, or taking the skin on the upper part of the buttock to give that lift where it's sagging below. So there are things that we can do. Maybe not all of them are ideal for the quote-unquote aging buttock, but we can address that with filler, with volume, or with skin excision.
Tell us about buttock augmentation with implants. Do you ever use them? Should we ever use them? Is that something we should be considering as plastic surgeons?
I think as a last option for volumization of the buttocks, it can work. It's problematic. The recuperation is very long. The complications that can occur are significant complications. So in my practice, in our practice, we don't encourage that.
Right. Well, I'm just like you. I would say that buttock implantation with devices is something that you should just say no to.
Sounds like patients really do have a lot of good options as long as they pick the right ones for buttock rejuvenation. So if you want to see more of this, you can see it on theplasticsurgerychannel.com.